Hello, everyone. Finally, day three, and we are with this amazing people. We're gonna talk about breathwork, and we're gonna introduce them first. Talk about how to reduce inflammation and balance neurotransmitters that contribute to pain with Dr. Tim Jackson. We have Breathwork with Kate Kendall, Airway, the hidden cause of ADD ADHD with Dr. Layne Martin. Then we have Children Autoimmunity with Fiona Mao, and then Breathwork again, Secret on to Longevity with Dr. Daphne Damon, Asthma and Liver Congestion with Dr. Carol Laurie. I'm very excited. What about you? Let's start the show today. All right. I was waiting for this summit for a long time, and I'm so happy to have all of you here. And some of you come from very long distance. Kate Kendall, she could make it. She's from Australia. I really appreciate it. And then Fiona Mao, she actually have a chapter in the Gap, so she's a bestseller author now, and I love her chapter. Dr. Daphne Neyman, she will talk about the breath work, and she could make it as well. She had some trip, and then she made some adjustment. Thank you so much, Tim and Lane, and also my amazing friend Carol Laurie. She's here again. Thanks, Dr. Carol Laurie. So first, we're gonna go through each of you and ask you to introduce yourself by in few sentences. So we start with Dr. Tim Jackson.
Yeah, so my name is Dr. Tim Jackson. Thanks for having me. I'm a functional medicine provider, a doctor of physical rehabilitation, and a clinical nutritionist. I work with clients around the globe on everything from healing autoimmunity to improving energy and vitality, as well as increasing cognition.
Beautiful. And Dr. Lane, um, what was your last name? Forgot. Yeah, you go ahead. Go ahead.
Yes, thanks. It's Layne Martin. I really
Yeah,
appreciate being
Martin.
here. Seems like a great group. I was a restorative dentist in Manhattan, New York, and basically was in a high-end practice. And a gentleman I taught with, every time we would discuss a complex case, would always, shout out, "I bet you the person has an airway problem." Next case, "I bet you they have an airway problem." And I poo-pooed it, but after the 50th time of hearing it, I was like, all right, tell me about this airway problem. Next thing I know, I'm doing an airway residency. And then after that, I sold my dental practice at the age of 45 to go back to school to do orthodontics and craniofacial orthopedics, because obviously there needs to be a paradigm shift in medicine and dentistry to start fixing these problems that we see. And I think our society has normalized snoring and sleep apnea and ADD and their treatment. So that's kind of my mission, along with all of you, to kind of really help solve problems and not just symptoms anymore.
So Lane, what I love, we talk about the gap, and that's what he said. So this is our mission to talk about the gap between the conventional and holistic medicine. We're gonna create this bridge together. We have Dr. Carol Laurie. That's my favorite friend. She was in my first book, Naturally Conceived. I mean, first contribution book, and she wrote a chapter there, amazing chapter. She's doing naturopathy and functional medicine, homeopathy, and what else? Acupuncture, right?
Yes. Well, thank you for having me. It's very great to be here. The longer I practice, the more I realize that all illness, no matter what it is, infertility problems, autoimmune, breast cancer, colitis, migraine headaches. One of the foundational components they all have in common is inflammation. And part of that is being able to detoxify from your liver, your gallbladder, and your gut. And I will be talking about that today.
Beautiful. She's very resourceful. Every time we have different topics, even fertility, even about the a whole health, or even about asthma, she's always there supporting me. Thank you so much. And Fiona Mao, she's the nurse practitioner, and she's gonna talk about autoimmunity with children. I don't want to go ahead. Just try to introduce you, but go ahead.
Thank you so much, Pantea, for having me. It's always a pleasure working with you. My name is Fiona Mao. I am a nurse practitioner, and I'm also a functional medicine practitioner. And what I do is I help parents understand their children's unique body chemistry so they can reverse their chronic health symptoms and also elevate their health. So this is what I'm passionate about, and I am so happy to be here. Thank you so much.
Yeah, thanks. I think you have to unmute yourself, Kate. Yeah, Kate. Kate Kendall, she's from Australia, and 4 a.m. there, 4:30 a.m. Thank you so much. I appreciate you could make it. Go ahead.
Excellent. Thank you so much for having me. Yeah, my name is Kate Kendall, and I'm based on the Gold Coast in Australia. So I'm a holistic health and wellness coach. So I'm a core clearing breathwork practitioner. I'm a hypnotherapist, meditation coach, a personal trainer, and I'm helping people to really minimize stress, work on their sleep, and using the breath, helping with anxiety, depression, and just minimizing those symptoms. And once again, filling that gap that we have. So using the breath is just so powerful to use it for pain and trapped emotions. I do a lot of emotional work as well. So I'm glad to be here to share. Thank you.
Thank you so much, Kate. And then we have Dr. Daphne Neyman.
Yes, hi. Thank you for this summit, and thank you for having us all here. My name is Dr. Daphne. I am the originally emergency medicine physician, converted to an anti-aging physician, taking care of or helping high-achieving middle-aged women get their youth back, energy back, and reverse some years without worrying how. And I also incorporate mind-body healing in my programs. And so breathwork has become very important in my life in the last year. That's how I also was able to contribute to the book. It's one thing that I think that a lot of people need in order to connect mind and body, and because it's the life force. So there is a saying, I'd like to say that if you want to change your life, your health in weeks, you want to modify your diet. If you want to change your health in days, you want to drink more water. And if you want to change your health in minutes, you need to breathe.
I love that. So we're going to go to Dr. Tim Jackson, and he's going to talk about inflammation and balancing your body. Go ahead, Dr. Jackson.
There you go. How long do I have, just so I know?
You start, and then we continue.
Okay.
5-10 minutes. 5 minutes.
So yeah, when we're talking about inflammation, it's usually multifactorial. And one thing I focused on quite a bit are stealth pathogens. So things such as Epstein-Barr virus, dysbiosis in the gut. It could be something like Klebsiella or Bacteroides fragilis, but also toxicity. And so the more toxic we are, the more viscous and thicker our blood's going to be. So the harder it is to deliver nutrients to our cells, thereby creating systemic inflammation. And so stealth pathogens, it doesn't have to be a recent infection or a current infection, but it has to be present in the body. And maybe you go through a stressor that kind of tanks your immune system, and then that pathogen flares up and creates what we call a cytokine storm, which is just a bunch of inflammatory signaling molecules that can cause pain, inflammation, brain fog, pretty much every symptom on the planet. And so we talked about toxicity, stealth pathogens, and blood sugar imbalances. They all influence, along with sex hormone imbalances, your ability to control and regulate inflammation. And once your body's inflamed, it's pretty much a self-perpetuating cycle. So you can remove the stressor, but you still have to turn down the volume on those inflammatory stereo controls. So one of those switches is called NF-kappa beta. And one thing that kind of turns the volume down on that is curcumin or turmeric. Other pro-resolving mediators, specific forms of EPA and DHA can help to turn down the volume at the cellular level in terms of inflammation, and also balancing blood sugar. And so that's a two-way street, because if your hormones are imbalanced, it's going to lead to imbalance in blood sugar, but blood sugar imbalances will lead to hormonal imbalances. And so you have to address it from all angles. But today, we have, everyone is focused on what they're putting in their mouth in terms of nutrition, but most people don't focus on what they're putting in their nervous system. And, our body's constantly sensing every thought that we think. Every thought has a physiological consequence. And so, the tapes that we have playing in our head, we may not be consciously aware of them until we work really hard to tune into them. But then we can modify those, and that helps to turn down the volume control on inflammation as well.
Thank you, Tim. I know a lot of contributors in inflammation, and we also, not only we need to discover them, but also we need to detoxify those inflammation and have a better healing process. So now we have Dr. Carol Lowry. She's going to talk about detoxification, inflammation. In case we have inflammation, that all of us do have it, right? Yes.
15 years ago, I picked up the phone and I didn't recognize the voice on the other end. And then I realized it was my dear friend saying to me, "I have breast cancer." Now, you may be wondering what that sentence has to do with what my topic is. And the answer is everything. Just as Dr. Tim talked about inflammation, healing your gut and managing your detoxification pathways and your inflammation are all in the same thing. When you hear a topic such as reducing your inflammation or detoxifying, and most people don't think about the liver and the gallbladder and phase 2 detoxification within this realm, but it's all the same topic. It's not something separate and outside of yourself. And people tend to get overwhelmed with this topic. I don't know anything about inflammation. What do you mean phase 2 detox? What does that mean? How does that apply to me? And the answer is, it's very simple. We start with a foundational approach, and that approach has to do with how are you eating? Are you eating organic? Are you eating a lot of processed foods in your diet? Is what you eat when you look at your plate, is it vegetable centered? Or is there a lot of non-grass-fed beef or farmed fish or non-organic chicken on your plate? Are you eating 3 meals a day, or do you do intermittent fasting and eat 2 meals a day? Are you eating processed foods? Do you go for fast foods for lunch because it's convenient? And how are you starting your day with your food? What we first put into our body determines the metabolic messaging that we're providing for ourselves throughout the day. So if you're starting your day with coffee, with a sugar frappy thing in it, and a scone or a pastry that has gluten and sugar in it, you're giving your body the message that the gas for the fuel tank of your body is sugar, wheat, gluten, and processed food. Really, it's sort of like putting sand in the gas tank of your car. Really what our cells need, and that has to do with how your detox pathways operate, how healthy they are, how smoothly and what the ability of they have to help process things out of your body that you no longer need. What your mitochondria needs are phytonutrients from vegetables, protein from organic meats and fish, and lots of sufficient amount of water and fiber. So we need to think about detox pathways in very simple terms. We want to break it down so you don't get overwhelmed. The second aspect I encourage people to think about is your home is your sanctuary. Do you have eco-organic products in your house, or is there air fresheners and plug-ins? And the worst for me is dryer sheets. When you get out of the shower and your pores are open and you wrap yourself in a towel, or you sleep in sheets that have been dried with dryer sheets, you are putting those toxic chemicals into your skin, and they are becoming absorbed in your skin, getting into your body. And then your liver and your gallbladder, phase 2 detox pathways, need to take them out of your body. And sometimes they are overwhelmed and they can't do that. And those chemicals then stay in your body. And that is the beginning, as Dr. Tim suggested just now, of major inflammation. Your cytokines get elevated, your NF-kappa B becomes elevated. These are all medical terms which most people don't know about. But as you hear them, you become more familiar with them and they become second nature to you. And that's what this whole summit is about. We want to break everything down so you become familiar and not overwhelmed. And then you can become empowered to make the changes you need.
Thank you so much. Always informative. Fiona Mao, I know she has a story inside her book. I mean, the book, The Gap, a chapter about autoimmunity. She fought with this inflammation. She detoxed to save her baby. And she's going to talk about it and to just show you how these inflammation and detoxification are so related and how we can do it on our body.
Thank you, Pantea. So I have 3 daughters. So my oldest one was normal. And I thought, okay, so every child, it's going to be, just a very easy ride. She slept very well and did everything. Then when I had my second daughter, she had delays. She crawled very late. And that wasn't as concerning as much as when it came to the speaking aspect. So she wasn't talking. And that's kind of like when I started noticing, oh my goodness, like what's happening? So this whole time I didn't know about functional medicine because I was just doing like the NP role. Then I had another child. She was unexpected. So within like 18 months, so I had two, so I had my second and my third, and she had like really bad eczema. So in this whole process, I kept going back to the doctors and asking, hey, like, what can I do? What can we change? And I wasn't really getting answers. I was just being told, oh, we just have to wait for my middle child who was nonverbal. They just told me, wait till she's like 3 and, we might, diagnose her with this, with that. And just the idea of what they were throwing at me was just overwhelming. And then for my child with eczema, Faye, it was just steroids for the most part. And I wasn't really happy with that because I'm thinking, okay, so I have all this information, so I thought, but then like I can't even help my own kids, So I started looking for help. And this is kind of how I got into functional medicine. Some of the things that I actually did to help my daughters was, one, I did a hair test. And at the time, I didn't even know that there was functional medicine in the US. So I actually did this thing from like UK. So I sent her hair all the way out there to kind of just help me know, what toxins or whatever it is that they're saying it could be. So in the process, I went back to school and started learning about functional medicine. And I noticed that toxins are very, very important because like if you don't know, then you're not able to address it. And then also when it comes to food, you have to pay attention because something that may be good for me as the mom who's like breastfeeding may not be good for the child. So at the time, I didn't even know about my own food sensitivities and any of that stuff. So in this whole journey, I learned, okay, so even though a food looks right, even though it's a fruit, even though it's a vegetable, it doesn't mean that it's good. So I had to know that, okay, I have to know that this child is different, this one is different, and I'm different. So how can I help us? So we all had to come together and change the whole diet thing. So between diet and then also the stress level, because when I was pregnant with my third child, I was really stressed because I'm thinking I'm going to have another child who's also going to be nonverbal. So I was just a high stress zone, which is really not good for the development of the child. So all these things, I think parents are not aware. And so my message is just trying to help parents know that from the time before you conceive to the time you conceive and even after, like your thoughts, your energy, everything you put into your body, your environment, everything matters. And the only way that I got to know this was through a very painful experience. And I'm hoping to help parents so they don't have to go through this whole experience. So fast forward, and thanks to functional medicine and the testing, my kids are pretty much okay. My daughter has she's in her grade and she's not behind or doing anything of that sort. And my last born has good skin, but it's because of a whole lifestyle change. It's not something that you can kind of like do now and then stop. It's something that you have to consciously make that effort to keep choosing a healthy lifestyle.
Yeah, thank you so much. This is a background for asthma as well, because no matter what disease you have, any chronic disease, autoimmunity disease, needs some precaution, lab testing, and also you may even need to go to acupuncture to correct it. So there are a lot of things connected to each other. Here we talk about inflammation with Dr. Tim, Dr. Carol Lowry, and Fiona Mo, she is a nurse practitioner as well, and this is a real example of how these are connected to each other. And for the asthma, that's the same thing, because if you have inflammation, if your liver is congested, if your body cortisol level is high, there are some problem in your body. It comes from your breathway. And then I have Dr. Layne Martin. He's going to talk about airway. As I said, again, airway, when you talk about airway, is not only talking about the lung, right? There are so many things, a lot of hidden layers we should clear. Dr. Layne Martin?
Yep.
Yes.
First of all, what great speakers. And it really ties into what, I saw in my dental world. And, every time I lecture, I always start off asking a question of, imagine getting a call that your 40-year-old patient and friend just died. Unfortunately, I actually got that call a year ago. And my buddy didn't die in a car accident or from cancer. He died from the comorbidities of obstructive sleep apnea. He had an airway problem. The issue is when he presented to my office probably about 7 years ago, he had all the signs and symptoms of someone with an obstructed airway. He snored, hypertension, acid reflux. However, he had broken down teeth. His teeth were all worn down and his vertical dimension of his upper and lower jaws were collapsed. And at the time, I restored his teeth and I restored his vertical, but I missed his real problem, his airway, right? I treated his symptoms. And that's what we do in medicine and dentistry, right? Like that's a lot of what we do. And, you heard me tell the story that I did an airway residency. So I was basically able to recognize the problems now. I just didn't know how to fix them, right? I saw these patients and every dentist sees this, right? Like when I did that airway residency, I noticed that the things I was seeing every day in my office for the last 15 years was the sign of an airway problem. And as dentists, we see it every day. It's worn down teeth, collapsed vertical, cross bites, high vaulted palate. They're all signs of an airway problem. And I missed them. I missed them for a long time. So I sold my dental practice. I went back to school at the age of 45. And I was on my way to really helping people. And then I got a phone call in 2019 from a friend of mine that Ron died. And Ron was 55 and he died of heart failure. And I saw it when I treated him. I knew he had sleep apnea. The same story as my buddy. He ground his teeth down, collapsed vertical, snored, hypertension, acid reflux. So as dentists, we have a huge opportunity to really collaborate with physicians because we're seeing these people so much. Because we're taught in school, and I'm sure you guys are taught, people clench and grind from stress. It's not, it's stress from suffocating. So, you know, like I could talk for 10 hours on this, right? Like all the kids with ADD, they don't have ADD. They're not getting oxygen to their brain, right? And that's what our society has done. We've normalized snoring and sleep apnea and ADD. And how is it normal to give a 30-year-old a CPAP, right? You're going to give someone an adjunct for 60 years and be like, here, wear this. I mean, we do it with night guards, right? You do it with kids with Adderall and Ritalin. So, you know, everyone here is talking about inflammation and we talk about oxidative stress, and it's so much of it stems from really an airway problem. And as dentists and physicians of seeing these people all the time, that's kind of why I do what I do now, right? People ask me why I do it. I had patients that die and I saw it and I told them to go get a sleep test and they never went. And, you know, that's the other problem. I think the metrics with sleep apnea is screwed up because, you know, I took a sleep test and technically I was fine, but I wasn't. I was snoring. I was tired. Mine is an anatomical problem. And I think that's the other thing is if you look at what this is stemming from, if you look at the skulls of Neanderthals, the skulls from 500 years ago or 1,000 years ago, it looks very different than what we look at now. And that's why I went into orthodontics, because we really could help grow someone's airway and really help fix the problem and collaborate with all of you to do that.
Beautiful. You know, that's the thing we never think about it. Like, right, you have asthma, you go and use your puff, but you may have some teeth problem. Maybe your avers is closed or you are crunching, you know. So as I said, that's why we all connected, we are all related, and that's why people like doctors always refer one to another, because the body should be work like an orchestra. Everything should be work at the same time, right? So now we're gonna talk about breath work more, because now we have some background about that. Kate Kendall gonna talk about emotional effect on breath and lung disease.
Awesome. Thank you so much for having me. So today I wanted to talk about a beautiful practice that I came across about 5 years ago personally for myself. And it's called a call clearing practice. So it helps people to move from the head to the heart. We're so busy, we're living in our head, and you know, the stresses in life. And what this practice is, a very, very gentle practice. This call clearing is a heart-centered empowerment practice. So this one I'm going to talk about tonight is today for you guys is it's a nose breathing. So it's a very gentle breathing, and the benefits are it dissolves the causes of anxiety, frustration, stress, anger, sadness, helps to be able to be in a safe place to be able to release these emotions. The stored emotions causing body pain, causing troubles with sleep, and you know, just the physical pains that are stored in the body from these suppressed emotions. So helps to clear self-sabotage, procrastination, helps to gain clarity, really move into the heart and get to that, back to that, you know, core being. And you know, when we're stressed, we're doing really short, shallow breathing. So that really is stopping the oxygen, you know, coming into their body. And, you know, it's just the heightened levels of stress then affects the choices that, that they make around food, choices around, addictions, drinking, alcohol, all those kind of things. So it's a real holistic approach to, slowing down and moving into our body, so that the choices and decisions that we make and the emotions that, so many people are pushing away our emotions and pushing them down, which is causing a lot of problems within our bodies. So one of the ladies that I worked with a couple of years ago, she spent over $30,000 going to psychologists, psychiatrists, and a whole heap of different practices. And she had nautical panic attacks, which actually caused nausea, vomiting, body tremors. She had horrific anxiety. She'd wake up at 2 a.m. in the morning and would sometimes last all day or go for weeks. And we worked together, and she was the first session was just such a powerful transformation, because she was able to, the emotions that she had pushed away pretty much all her life from a teenager. So this goes back to not actually going back in timeline, that you're going back to regurgitate this trauma, so to speak. It's more to be able to come to peace and be able to release those emotions that have been stored and trapped. And that lady was able to actually work through her sadness, which was actually related to an experience that she had with her twin brother, and also anger. She had not cried pretty much her whole life, and she had to be tough, and she was in the defense. So just being able to release that, she now has her panic attacks and her night sleeping. She's able to you do the breathwork practices to get herself to sleep, and also if she wakes up happens to wake up throughout the night, she has this, the breathwork practices to be able to calm her nervous system and be able to get back to sleep. And it's just such a powerful, gentle practice that, is helping so many people to minimize some of these stresses in the body.
Thank you, Kate. We're going to have a few second break and come back. Please subscribe to Quanta Calhoun Transition channel and order my book, The Gap, in Amazon. Thank you for watching. All right, we are back. We're going to continue breath work with Dr. Daphne Neyman. She has a chapter inside The Gap. And she's gonna, I love the methods she introduced in the book. Can you talk about these methods a little bit? I want some practical notes to this summit. Yeah, are you mute? Go ahead.
You unmuted me. Yes, sure. I'd be happy to do so. First, I'd like to mention that being in the emergency medicine, I actually had a pretty toxic lifestyle in general. And over the years, especially towards, as you get older, things don't get better. I actually gained about 30 pounds. And then I was quite toxic overall. My thyroid had taken a hit. My adrenals were not doing well. So, and I thought that this is how I'm going to go into, this is my, I'm going to keep gaining weight because I don't know how to lose this. I think I'm eating the right way. I think I know everything. It just doesn't really work that way, because if you're just focusing on the food and not really looking at a person as a whole, you're just not going to achieve the results you'd like to. So as I was going through my own journey, I realized the importance of the mind-body healing. And that brings me to the breathwork. Breathwork is amazing. When I first got exposed in a functional medicine conference, it was quite a breakthrough experience for me. So I like to talk about it, and I like to give these breathwork sessions to my clients as they're going through their journey of losing weight, gaining their health, reversing their rapid aging, etc. So, and there are a lot of techniques, and breathwork is not really just one thing. When you say breathwork, it's actually, there's a lot of little techniques, and then there's also a sequence of exercises we deliver to help you sort of condition your breath. And so it's pretty wide area. So it's, for people who don't know, it sounds like just one way of doing something. It's not. There's just so many options out there, and there are schools around the breathwork. So couple of quick, easy breath exercises could be for calming. For example, the box breath is a great calming example. It's 4-second breath, 4-second inhale, 4-second hold, and 4-second exhale. And how to count the seconds could be challenging for some, but I always remind them you can say 1 Mississippi, 2 Mississippi, 3 Mississippi, in that way. So breathing like that up to 4, holding it for 4, letting it go in 4 counts like that actually is quite relaxing. If you find yourself in the middle of some maybe conflict or stressful situation, doing that for a few times will actually calm you down. You can actually expand on that. Some people do a little bit longer. Some people prefer to do it 5, 5, 5. The idea is to really create that pause and having long enough exhalation. And another variation of this is actually 4, 7, 8 breath, where you actually inhale in 4 seconds and you hold it for 7 and you exhale at 8. So the longer the exhale, the more calming it is, clearly. And that's actually great when you want to settle down to sleep, maybe to really, really relax. I like the 4, 4, 4 for when you're driving and you're stressed out. The traffic is at you, like people are, like you really want to get to some place, or somebody is driving slow in front of you, whatever the reason that creates that tension when you're driving. 4, 4, 4, I think, is a rescue breath. I think it helps a lot. There are other techniques, for example, for allergies. You can, for people who have congestion in the nose, you can actually do a quick technique that decongest your nose. A quick information on that is that our nostrils don't operate the same way throughout the day. We alternate breathing, and we have this, what we call erectile tissue, and one side gets engorged, the other side, opens up. So it alternates every few hours. And interestingly enough, our right nostril, it has, it's like, think of it like the pedal, like braking, putting the brake on, is the parasympathetic, it's linked to our parasympathetic system, whereas the left side is linked to our sympathetic system, the active side of us. So by alternating nostril breathing, yoga too, which they overlap with breathwork, the breathwork and yoga breathing techniques overlap with each other, you actually learn how to balance your breathing. And you can also use this for allergies. So basically, one quick way of doing that is also written in my book is you'll take a couple of normal breaths and you let go of your last breath and you pinch your nose and you shake gently back and forth a few times till you really need to breathe. And then when the time comes for you to breathe, you just take a normal breath. Doing for a few times actually opens up the nostrils. Now, for people who are really sensitive and have severe allergy symptoms, that may not be like cure for one time and that's it, you're done for the day, but it does give some relief. I haven't heard anybody who doesn't have that relief, even if it's momentarily.
Thank you.
Yeah,
Thank
you're
you.
welcome.
These are very practical. If you want to follow, you can go and read her chapter in the gap. Now we go back to Dr. Tim Jackson about the inflammation. How inflammation causes pain? You're mute again.
So inflammatory compounds such as cytokines, etc., C-reactive protein, they're all going to become elevated in the bloodstream when there's inflammation. And ultimately that leads to an imbalance in neurotransmitters. So we have two neurotransmitters, glutamate and GABA, and they're sort of on a seesaw. So you never want to have really high levels of one and low levels of the other, or vice versa. When glutamate, which is pro-inflammatory, goes way up, the sympathetic nervous system goes into fight or flight. And it's not true that one side of our nervous system is 100% on and the other's completely turned off. It's more of a balance and a percentage. And so if we can raise GABA or improve GABA levels, lower glutamate levels, and assist with the clearance of glutamate and conversion of glutamate to GABA by using things such as activated B6, we can decrease pain response and inflammatory signaling, because we know over long term that pain changes the brain. So neurons, brain cells that fire together, wire together. And we have to send signals to the brain that lets it know we're safe, we're secure. And so the reptilian brain, all of our basic life functions are ultimately controlled from the base of our cervical spine. And so things like breathing, etc., are controlled from that area. And when we're in pain or when our oxygen levels are low, like Dr. Layne was saying, one of the most common causes of inflammation is what we refer to as subclinical hypoxia. And so the width of the maxilla, the upper jaw, optimally should be, and he can correct me if I'm wrong, around 42 to 44 millimeters. I think that comes out of the Pankey Institute, if I'm not mistaken. But there's a great book called 6 Foot Tiger, 3 Foot Cage, and then I'll stop talking about it because I don't want to steal his thunder. But as someone who got taken down the oral surgery rabbit hole, I was told that I wouldn't have any teeth by the time I was 30 if I didn't get this surgery. Well, now looking back, I realize how ridiculous it was. But at the time, I was 20, almost 21. I said, oh, can we schedule the surgery for tomorrow? I don't want to lose my teeth. But the surgery, not only did it not help, it created pain that I never had before. And not only that, it didn't help the snoring issue. And the trigeminal nerve, which feeds our face with 3 branches, it feeds into the same group of neurons called a nucleus as the vagus nerve. So it plays a role in the tone of your sympathetic versus parasympathetic nervous system. And so what am I saying? I'm saying that the jaw being out of alignment and lacking optimal width will create subclinical hypoxia, low oxygen, and that's going to create inflammation and pain.
That's interesting. I think Layne want to continue, right? I saw you.
Well, no, I mean, Tim brought up an amazing point. It's totally driven by the maxilla. And if, the problem in orthodontics, and I'm in it now, is that everyone would always say, well, wait till your permanent teeth come in. Well, it's too late. It's the same thing that, I get questions all the time about, is it normal for my kids to snore or grind their teeth? Absolutely not. They have an airway problem. Forget sleep apnea. It's an airway problem. And when you see a 3, 4, and 5-year-old that's snoring, that kid has a problem. And an unhealthy kid is going to grow up to be an unhealthy adult. And to Tim's point, Tim, I swear, if you can get someone's maxilla 44 millimeters, God bless. I'm happy with 38 to 41. I'm a problem, right? Like, I have a problem because it all stems from industrialized diets, lack of breastfeeding, and Gerber baby food. And I grew up on them. And as a 49-year-old, I'm in orthodontics right now because my maxilla was really narrow, right? I wasn't breastfed, and I had allergies, sinus problems. I was definitely hyperactive, right? And that's the problem. I have an airway problem.
Thank you. Dr. Carol Lori, do you want to add something to it?
Paul, I
Yeah,
love
yeah.
it.
Yeah,
I love the whole body approach. I think that's the beauty of functional and integrative medicine. It's not just the problem that you have. We need to go deeper and look at all the contributing factors. When I heard Dr. Layne talk about children with snoring, I'm thinking so many of them are eating processed food and fake cheese and dairy. And it's, I used to see a lot of children in my clinical practice, and getting them off all of that junk food and the dairy resolved so many of the problems. And the same goes for adults. It's not just your main complaint that is the issue. We need to dive deeper and look at what are you feeding your body as far as food is concerned. What messages are you providing to your mitochondria for gas tank energy, so to speak? And how are you eliminating in your body? Are you eliminating every day with bowel movements, or does this happen every 3 days? And what do they look like? Do they sink or swim? I know this is not a particularly popular topic to talk about, but you can get a lot of information about what's going on with your phase 2 detox pathways by what your eliminations look like and how often are you eliminating?
Carol, I see a lot of people have problem with the detoxification because when they do the first phase, they think that they have to stop because their body try to adjust and they don't go to phase 2. So can you just um, elaborate this phase 1 and phase 2? Yeah.
Phase 1 is what happens when the food goes initially through your large and small intestines. And then phase 2 is what happens when they take that, when your biochemical processes in your intestines take that material and make it water soluble so it's able to be eliminated in your stool and your urine. And there are different biochemical processes that are required between phase 1 and phase 2. And you need both of these processes to be a healthy adult. Now, if you have inflammation and you have certain elevated reports on inflammatory blood markers, or if you're doing a stool analysis and you're showing that there's leaky gut in your gut, or you have some elevated bacteria or yeast or parasites in your gut, that impacts your body's ability to healthily and properly do phase 1 and or phase 2. So the good news is we can use functional medicine testing to look underneath and discover exactly where the problem is. And I love that because that way I'm not like haphazardly throwing vitamins or targeted supplements at someone. I have exact information that I can then use to provide the best diagnosis and the best treatment for people.
Exactly. When I talked to Fiona, she said the same thing. I said, okay, what should I do with the, let's say, 3-year-old baby? How can I see the lab test? Because for them it's not easy to do the blood or whatever, especially when they are much little. And she said the stool test. Fiona, can you talk about your own issue? When you did the stool test for your baby, how did you do the detoxification for her?
Yeah, so just like what Dr. Laurie said, and also Dr. Jackson and Dr. Layne, inflammation, for me, I think that is pretty much where this whole thing kind of lies. You know, for someone to get to like autoimmunity, it's not something that just happens like overnight. It's like the little steps that keep happening over time. And if we don't catch it fast enough, that's kind of when you have like a full-blown diagnosis, say asthma or eczema. So as far as like trying to detox, you want to first identify what it is. So for example, with one of my kids, they had parasites. And I was like, what? Like, how, what, where, how would she have parasites? But that is exactly what the stool test told me. So if you kind of have like something that's guiding you, then you know, okay, so I need to address this parasite. Because if I just kept on going on and on, just making sure that I'm doing like an organic diet, you know, it's gluten-free, it's dairy-free, but I am not addressing the pathogen, I am not, it's pretty much like I'm not really working at the root cause. So I'm not going to be reducing the inflammation, but more like just kind of like symptom management, because I still have the parasite there. So you kind of have to go down to see, is it pathogens? Like, is it a bacteria? Is it fungal? And then you also want to support the body. Before you even go into this whole detox process, you want to make sure that you're doing it from a place of strength. Meaning you want to make sure if there are any nutritional deficiencies, you want to address those first. Because if you're already weak, like if your foundation, the body is weak, and then you're trying to do more detox, it's going to do more harm. So there's ways to kind of safely do that. I don't know if that makes sense.
Beautiful, yes. And Kate, about the emotional effects of, do you also recommend detox to your patients?
Yeah, I do.
Yeah, tell me about the emotional detox.
Yeah, so the emotional detox is really just going through the core clearing, and also outside of that practice, be able to understand their emotions and be okay with not having shame or guilt around feeling anger, feeling sadness, and feeling, judgment, and all those kind of things that can be shamed upon. So being able to, getting out your journal and writing down how am I, asking yourself, because how often are we just so busy and we don't go, how am I actually feeling right now in this moment? And, tapping into that and then having that moment where you can release it by journaling or doing some breath work or doing some meditation and just being still in that present moment and just breathe. Because we're, that one breath right in this present moment, we don't think about, that perfect breath that we had a week ago or 2 weeks ago. The breath brings us into this present moment right here, right now. So, to be able to work through and flow through those emotions. We can go through anger, through to frustration, through to sadness. There's different layers. And as we move from the head, we, through the thoughts, through to the feelings, through down to the emotions, we get down to the core of what's actually really going on. And to be able to go through that, and we can sometimes go up and down in that process. We can come, down to sadness, come back up to anger again, and just being able to air and talk about that, what is actually going on without any judgment is really a detoxification for people to be able to release that and be able to have that space is what I find. And it's really, really so powerful. And, the core clearing breath work, just to give some, some kind of practical, things that people can do. The Dr. D, is it?
Daphne.
Yeah.
Dr. Daphne has some relaxation method for through breath work. If you can show us, let's say for like relaxation and meditation method for breath work.
Yeah, absolutely. So the one I was going to talk about is a 4-4, which is 4 breaths in and 4 breaths out. There's no holding of the breath in this practice that I wanted to talk about today. So it's really just a very slow breathing in, 4, 3, 2, 1, 4, 3, 2, 1, and just really slow tempo. And the core clearing breath work is a nasal breathing, as I said earlier. So it's just breathing through the nose and exhaling out the mouth, and it's a full belly, chest, and upper back. So we're really breathing in down into our belly, up into our chest, and opening up and expanding throughout your back. And it's an active inhale and a passive exhale. So we're breathing in and really letting go each and every breath. As you let go, as you breathe out, you're letting go and letting the body relax that little bit further. And it's a circulation, like the waves going out and coming back in, going out and coming back in. So it's no holding, holding at the top, holding your breath for this one, which is very gentle and soft, and it's non-invasive process. So,
Daphne, do you want to add something?
No, thank you, Kate. That's great. And it's funny how these breaths are named different ways. And that, in fact, in my training, it's called earth breath because it's an earthing kind of breath. So the same idea, same concept. I love that because that's how we actually ease into the exercise. We start with the earth breath, and now we kind of pick up the pace, and you're pretty much exercising your breath and the things that you wouldn't want to do when you're normally, in your daily activities. It's really like getting on a treadmill. But that's so the earth breath is awesome. It kind of grounds you, and I love that one. And I'd like to add to by saying that, with each breath, you inhale the future and exhale the past is a great way of us reminding ourselves to, kind of like relaxing and emotionally healing in a way. Breath is definitely the connection between mind and the body, and it's the life force. So it's interesting in the sense that although it is regulated in our respiratory center in our brainstem, at the same time, unlike other visceral organs, we do have control over it through our cortex. So that makes us quite unique, and we're able to simply tap into our nervous system by using our breath, and that makes it so powerful.
Beautiful.
So that's why I love breathwork, and I think everybody should be, involved in getting to know and learning more about breathwork and practicing more. And I think one more thing I'd like to mention is that breathwork starts with really understanding a proper breathing. So, and which starts at, as Dr. Martin has mentioned, is actually with the airway and where you breathe, how you breathe. Are you a mouth breather? You have to breathe from your nose. And if you're a mouth breather at nighttime, of course, you have to seek for professionals' advice. Some people try mouth taping at nighttime. That may work for them. It may be a quick, easy fix. And that's not so easy to say because it feels like some people feel like they're suffocating, when they first try it. So they may ease into it by trying 5-10 minutes before bedtime. But so it starts from the airway. And so we need to know that we want to breathe from the nose. We want to use our diaphragm as much as we can. 70-80% of the breath should really incorporate the diaphragm because all the parasympathetic fibers are also down in the below. So we can relax better when we use a diaphragm. And so proper breathing, posture, these are very important elements of breath.
Yes, thank you so much. I love this interview because I also had some asthma problem, and I knew through functional medicine it really shows that how your hormone levels go, or what is your problem with the gut, everything related to each other, even the fertility problem related to your breath and asthma, so that's the interesting point. So that we are very close to the end. I need you one sentence, any of you, to give us people who are struggling with breath. Give them some hope with one sentence. We'll start. Who is going to go first? Daphne, you can go first.
I was going to use the saying from Johnny Long, breathe like you mean it.
Yes, that's it.
Okay, so can you elaborate on what else you would like me to talk? Like you mean?
Yeah,
like,
that's it. Okay, breathe. Okay, breathe.
That's actually that's the quote itself. Breathe like you mean it. Meaning,
Okay.
like, really want to pay attention to the way you breathe. Take yourself into the now and take your time, because a lot of times we are in the rush. We're just fast breathing or holding our breath. So you just want to focus on your breath, as Kate has mentioned. Be in the moment and enjoy the breath and slow down.
Kate, you want to go next?
Yeah, sure. Thank you. So I just wanted to say just the power of the breath, and it's so underrated. And people that are starting out, just give it a go and just do 1 minute, because I think with meditation and breath work and taking time out, people think you've got to spend hours or half an hour, and people just like really don't feel that they can be in that moment to just stop for that long. So just take 1 minute, do 60 seconds, and just practice and keep practicing, and then it becomes easier, because it's like anything, and going to the gym and trying new things, it takes time to practice and become a habit and a behavior. So starting out small and get better at it. And just remember, like meditation and breath work, so many people think that they've got to be, their mind's got to be totally still, and they're like, I can't get my mind to, stop. And that's okay. Just acknowledge those thoughts, let it go, and come back to the breath. It'll just happen again, continue, and come back to the breath.
Meditation is practice. I remember myself 2 minutes, I couldn't. Then I'm doing it every day with 15 minutes, which is amazing.
That's amazing. Yeah. So start small.
Exactly. Who is going next? Fiona, you're going to talk about one last sentence. Oh, you are mute. Oh, yeah, good.
Food allergies and toxins can actually affect your breathing. So if we could just take time to realize how to eliminate toxins, how to eliminate stress, how to eliminate crap food, that will also help our breathing.
Good. Carol? One sentence.
It's easy to get overwhelmed when you are not feeling well and you don't know where to start. So my recommendation is to find a practitioner who can guide you on your healing journey.
Thank you. And team?
Yeah, so mold can actually colonize the paranasal sinuses. And so nasal breathing is extremely important. But if you've been exposed to mold, and a lot of times we can't see it or smell it, so we have to do a urine mycotoxin test. But you need to find an ENT who can go in and scrape your sinuses and also prescribe some nasal antifungal sprays.
Thank you so much. Layne? Oh, hang on, you're mute.
So our teeth should touch for 20 minutes a day when we swallow. You have to breathe for 1,440 minutes a day. So it's not necessarily for this group, but for dentistry, they have to start looking at airway and not teeth, because I missed these things for so long, right? And Eleanor Roosevelt, learn from the mistakes of others. You can't live long enough to make them all yourself. And that's really the point, is that there needs to be a paradigm shift. You all are doing it, right? But it needs to happen in medicine and dentistry to start looking at root cause, because all the people that come in with multiple meds for hypertension, AFib, diabetes, acid reflux, ADD, those people probably have an airway problem. And that's really a lot of the causes.
I learned a lot today. Thank you guys for being here, making your time to be here. And there is a website there, hchoice.com, hchoiceidea.com, funnel the gap. And you can go there and be connected. We finish the summit today, but you can still be connected and you get the freebies. They have amazing freebies, ebooks, detoxification guides, and so many things there. So if you want those freebies, go and sign up to this summit. We also have the book, The Gap, How to Reverse Your Chronic Pain, and you can get it from Amazon. It's there and also in the website. Thank you so much, and hope to see you guys again for another one-on-one interviews or other summits. Thank you so much.
Thank you.
Thank you.
Thank you.
Please subscribe to Contact Transition channel and order my book, The Gap, in Amazon. Thank you for watching.